to Common Ground, a Bible-based discussion on day-to-day issues we encounter as Christians. Here, we will tackle different issues, share different experiences, and gain wisdom from God's Word, the Bible, our common ground. Nakakaramdam ka ba minsan ng paninikip ng dibdib? Disoriented? Magulo ang pag-iisip? Pabago-bago ng emotions? How do you make sense out of these feelings? Ano ba ang dapat nating gawin?
Hi, I'm Iris Season. First of all, I'm a follower of Jesus Christ. I'm a daughter. I'm also a sister and a fur mom to a cute dog named Delight. And I'm also a medical doctor by profession, specializing in general adult psychiatry with a special interest in palliative care. And I'm here to be with you to share things and insights and hopefully to broaden our understanding with regards to mental health.
I am Jennifer Soon. I am a child of God, currently navigating through infertility and anxiety disorder. For my profession, I'm a teacher, I'm a writer, and a speaker.
Hi, I'm Tina Christina Ko, and I am an adjunct faculty at Asia Theological Seminary. I'm also a pastor, and I'm serving at my home church and doing counseling and conducting trainings. A lot of trainings, mostly on mental health.
Hello, I'm David Chung. My educational background is in psychology, biblical studies, and history. My areas of interest also include culture and Christianity, theological issues, contemporary issues, and close-up magic.
Will you do magic for us today?
Maybe another time.
All right. State of mind, mental health, anxiety, depression. These are words many of our brothers and sisters are currently facing, but no one dares to talk about. Even in the Chinese Filipino culture, this is considered a taboo. So today, let's try to understand ano nga ba ang mental health? What are its causes? How can we manage it? And how our spiritual journey can help conquer it. So, Dr. Iris, maybe I can start with you. Ano ba saan ba nagsa-start tong mental problems or mental health problems natin? Is it something like a behavioral problem? May kulang ba sa biological makeup ng isang tao?
Thank you. So, I'll talk about yung biological causes of mental health conditions. So let's try to deal with its lifespan. No? Definitely, biology plays a part. No? For example, if you have a family history of a mental health condition, that can predispose the person to having it. No? At birth, when the mom is of advanced maternal age or during the pregnancy, it was difficult, traumatic, or may complications sa child or dun sa mother, that can also affect the brain growth. No? Also, in the child's development, there might be neuroinflammation, neurotransmitter imbalances. So, yun, nakaka-affect yung mga yun. And then, sa life stage naman ng siguro mga young adults or adults like menstrual irregularities, PCOS, no? What else? Yung medical problems like thyroid conditions, no, diabetes, pag progress tayo older post-stroke, no, they're more prone to having depression, yan. And also some medications like oral contraceptives, some antibiotics or antivirals. So may biological din siyang side.
So ang dami pala, no? Hormones, yan. Even inside the womb, no?
Yeah, even also to add, mga life transitions like pregnancy, peripartum, postpartum, infertility, no? Andropause, menopause, yeah. They can also parang increase the risk for having mental health conditions.
Okay. So that's going to the medical side, no? How about external factors that can cause someone to undergo this mental health disorder? What do you think are these causes or these external factors?
For one, if a person lacks coping skills, okay, And coping skills include also what we call self-soothing skills, no? Or regulation skills. So when we life is hard, no? So it's expected that sometimes we will feel very stressed. And how do we self-soothe? How do we regulate those emotions? So people who have stronger coping skills definitely are more resilient, no? Compared to those who have not learned to regulate themselves when they are experiencing negative emotions. Another is relationships. No? God created us to be social beings. So people who are loners, who are socially withdrawn, who don't have a good set of friends, no? Even one or two, they're really more prone to developing mental health because that's not the way God designed us to be. You know, God is a very social, a very personal being, and He has perfect relationship with, with two other persons in the Trinity. So we are also created to for deep connections with people. So if we are unable to develop a good relationship, connection with people, that will also put us in a very difficult place. No? Of course, the other one, I suppose, is faith.
Right.
So that's a spiritual resources. Okay, spiritual resources are also very, very important. People who know how to call out to God when they are in pain, when they are hurt, who have a personal relationship with God. They have the support that they need, in times of trouble, and that they are not afraid, no, to entrust this unknown future to a known God. Anxiety often develops because we don't like the unknown. We don't like uncertainties. But for people who know their God really well and know that even the unknown future can be entrusted to God, they can relax. They don't have to walk through life really worrying all the time because they know that whatever happens, God allowed it, and that God will be their strength.
You mentioned about spiritual faith. Maybe I would go to Boksu. Sometimes we hear other Christians, no, also going through mental health problems, no. So does it equate to having a weak faith, or in general, mahina siya, mahina ang loob niya? How would you address that connotation or comment?
Yeah, I think Tina talked about faith as a resource. So faith definitely in God provides us many, many things to cope with the problems and the challenges of life. But if I have a lot of faith, it doesn't mean I will not catch a cold. So just like the physical
Yeah.
can be ill,
Yes.
the psychological, emotional is likewise.
Yes.
It's not the amount of faith I have in God, but it's just that this is another dimension of my being, which happens to be unwell or a little bit sick.
Yeah.
Yes.
Sometimes there are trigger events. We try to cope up with, pressures and so forth. No? I'm not sure if you have seen a dripping faucet outdoors.
Yeah.
No? So it's dripping water, a drop at a time.
Yeah.
And the ground is concrete. Then after a long time, you see the concrete now not flat.
Right.
There's a
Yeah.
little dip,
Right.
right? So 1 drop, 2 drops, 1 day, 2 day, 3 days, 10 days. Now it starts to destroy actually the concrete. Dripping water lang. I think most of us probably have seen that. So sometimes it's like that. I'm bullied on day 1.
Right.
I'm bullied on day 2. I'm bullied every day, but I have to go to school.
Okay.
That's the dripping faucet. It may appear soft, but if you do it steadily for a long time,
Right.
I cannot cope with it.
Okay.
My solution maybe is to get out of this situation, like refuse to go to school or ask for a transfer and my
Right.
parents says, oh, or I just end my life because I don't want to go and nobody wants to move me to another school.
Right.
So this trigger event is victimization. You're victimized. You're targeted. And at first you can bear with it, but then after a long time you kind of give way, like the concrete giving way.
Yeah.
So, yeah, that emotions are a part of us, and just like the physical health can be damaged, the emotional health can also be damaged to a person of faith or to a person with no faith.
Thank you, Boksu. Wakang kakigay hikudi kong eko yatyong yaw, no? It doesn't mean that you're a person with strong faith doesn't mean you don't get sick, you don't get sipon. Tama naman talaga, no? Talking about triggers, so does that mean there are levels of depression na pag itong trigger na to lang, baliwala lang to. Pero pag medyo mas malaki yung trigger or depende kung ano yung historical background mo, mas malaki yung effect sa'yo nung naging trigger. How do you explain that, Doc?
Iba-iba yung each person is different. So we have like a common diagnosis, no? The presentation is different. So what I appreciate what Pastor has shared, no, so much. Thank you for validating that, Pastor. I regress ako a bit. I'll regress because I have encountered Christian patients and they have so much guilt and shame for, I guess, experiencing difficult emotions, and they feel like I shouldn't be feeling like this.
Yeah.
I shouldn't be seeing you. I shouldn't be taking your meds. But so it's ang ganda yung sinabi ni Pastor and ni Achi Christina that there are really a lot of factors like psychological if you came from abusive family or bullying, no? Or history of trauma, assault. So there are many various triggers and different triggers. I cannot say like this particular trigger, sure ball, magkaka mental health condition ka na. It's different from for every individual.
person, yeah.
Yes. As for the level of depression, yes, there are many types and many levels. No, there are mild, moderate, severe. There are single episodes. There are recurrent. There are those that comes with other mood disorders or anxiety or like a postpartum onset, a post-stroke onset, or with say panic attacks, psychotic features, atypical features. So marami siya different kinds. Yan.
You mentioned a while ago drink medication, no? Ano bang pinagkaiba nun? Maybe let's talk about title, no? A psychiatrist, psychologist, counselor, ano ba to? Ano bang pagkakaiba nitong mga to? At kailan ba natin malalaman na, oy, it's time for me to take medication or to seek someone and give me medication? Maybe both you and Atsi Christina can shed some light. Yan.
Counselor and psychologist and psychiatrist. So these three and even life coaches, no, they are considered mental health professionals. And at si Christina can broaden it pa. But from health and healthcare framework, or at least I view it from a sense of ano yung urgency. No? So if the person or the case is medically urgent, emergent, for example, ingesting a life-threatening amount of substance, no, life is at stake, uncontrollable seizures or panic attacks, ganyan, may harm sa sarili and sa iba, no, that warrants emergent care. Talagang ano na yun, either ER or where they will usually be referred to a medical team or psychiatrist, ganyan. Pag physical yung symptoms, physically symptomatic, like because he or she's undergoing emotional distress and does not eat, has been losing weight, has been vomiting, no? Parang yung sleep niya sobrang disrupted to the point na grabe na yung weakened ng immune system or daming pains in the body, no? I would still also refer that to a psychiatrist kasi aside from processing the emotions, pwede na rin magbigay or mag-start ng medications to alleviate the physical symptoms. No? For the psychologically naman na symptomatic, for example, a deep sense of isolation, depression, anxiety, interpersonal problems, difficult life transitions, no? Or even mga mental health conditions pero affecting more yung psyche or emotions, thinking. Psychologists can also be of help kasi they can really process the emotions and they can also do evaluations and battery of testing, ganyan. Also counselors, no? Pag more contextual yung issues, like, for example, academic or work-related or breakup, ganyan. Yung iba, they course it through goal setting life coach, ganyan. Through guidance counselors or HR, ganyan. So, ano bang difference? Parang, I think, pag psychologists, they usually have doctorates or masterals din, no? And counselors, they can do counseling and psychotherapy. Pag psychiatrist, so doctor sila, medical doctor na pwede mag-prescribe ng medications or admit if needed. Yan.
Okay. You want to add anything, Atsi Christina?
Wala naman. Basically is guidance counselors, they are doing more supportive roles. Okay. And more specific ang kanilang scope, no? Like anything related to school, to anything related to schools or sometimes even homes, no? That are affecting their students. Psychologists are trained to really help a person deal with mental health issues. No? Psychometricians are trained to administer tests, no? Especially in cases where you want to know, no, whether you really have, for example, do I have Asperger? Do I have ADHD? The psychologists, they administer that. Of course, in conjunction with, in partnership with their psychiatrists, no, or developmental pedia. Okay, but in a nutshell, psychiatrists are medical doctors, so they're the only ones who can prescribe medicines. They're the only ones who can, who know how those medicines work. Okay, and psychologists, counselors do more supportive roles, helping them understand their patterns of behaviors where they learn those core beliefs, you know, and especially beliefs that they never questioned, and or teach them coping skills. You know, a lot of mental health issues is a product of maladaptive coping mechanisms. In other words, we have not learned how to adapt in a healthy way. So patong-patong yan, no?
Yeah.
That's why we get more and more triggers until, you know, whole body is puro trigger buttons because we haven't really coped sufficiently and healthily. Okay, so one example, a common maladaptive coping strategy is denial, avoidance, destruction, no, in the form of destruction. So those problems never go away. You know, you just just suppress them, and until such time they will come back, no, to haunt us, or they will scream louder next time, you know, until we pay attention to them.
Boksu, in the Bible ba, was there ever a record of a Bible character or Bible characters who underwent mental health disorder to the point that, you know, they were not themselves anymore? Or is it different? Is it possession already? What are the differences in terms of the spiritual aspect?
In the Bible, we have people who are depressed, but not clinically depressed. It means they're just very sad.
Okay.
It's not a psychological disorder situation. So people who are very sad, we do have that. So when we say depressed, we mean it like not clinical,
Yeah.
right? Regular, very sad depression, that type. And then, of course, in the ministry of Jesus, we find people who are not themselves. But these are not psychological disorders. If it's a psychological disorder, we deal with it as a natural disorder. But if it's a supernatural disorder, then you have to deal with it supernaturally. So some years ago, I was asked to help a student who was in university, I think first or second year. So she was suffering a very serious disorder, but they cannot identify whether it's psychological or supernatural.
Okay.
Now she's in another city. So I told the friend that if we have to help her, we have to go to her. So we actually have to fly over there to meet with the girl. And then after about maybe 2 hours, I came to the conclusion that it's not supernatural.
It's psychological.
It's a natural disorder. So she should be treated, but she should be removed from that Canadian city and relocate to her home country where she can be treated better. The father flew in from China and cannot speak English, does not know anyone in the city. It's not a big city. It's one of those small cities. So it's really difficult. So that one is natural. So they have to have a psychologist or a psychiatrist deal with her. There was also suicidal tendencies and all that. I think it all happened when she visited a Buddhist center. And there was sort of a Buddhist ate. I don't know if she's a nun. I don't think she's a nun, a lay person. So basically, it was a psychological fraud situation. And so this lady eventually was asking for, I think, 200,000 Canadian dollars to treat her.
Wow.
So it's fraud, but she's very skilled in psychological manipulation and deception. So the girl actually believed that if I fly in a plane, I will die. So she refused to leave Canada. So natural lang yun. In another case was I received a call that there's a lady who's almost 30 years old. I can't remember, 27, 28, 29. Went to an Ivy League school in the US, is an atheist, does not believe in spirits and demons, but eventually suddenly cannot control her actions. So it happened like a few minutes, then 30 minutes, then it became 2 hours. So she's now a disruption at work and was sent home. So they asked me to talk to her. So the father and the daughter came and the 2 Christian friends.
Yeah.
And so I brought this young girl to my study with my English pastor and one of our elders, the 3 of us. So basically, after about maybe 10 minutes, I think it is a demonic situation. So it cannot be dealt with by the psychologists in the Canadian clinics. So you have to deal with it as a spiritual encounter. So eventually it took 2 days to liberate her. And eventually the whole family became Christian, disposed of all their idolatrous paraphernalia. And it was okay after that. But this is happening so frequently in Canada, which is supposedly a very advanced, scientific, wealthy country.
Right.
Pastor Andy, who's a graduate of Asian Theological Seminary, was ministering in Alberta among First Nations. First Nations means the original inhabitants. In America, you call them the Indians. In Canada, we call them First Nations because they were there first.
Oh.
First Nations. So First Nations always, very frequently, have encounters with aliens and UFOs. And they believe they're from outer space. And they have all this in their historical art, where you have something flying in with wings and that. And these are supposedly spirits and then eventually aliens. Then one time, there was a very big Indian guy. He was out of control. And then he rushed at Pastor Andy, straight to him. Pastor Andy is a strong person, but not as big. So he simply extended his hand like this and says, "In the name of Jesus." And the guy froze. And he walked away like that. His hands frozen. He was coming to beat him up, right? Then walk away. That's not psychological. If it's psychological, somebody is in the hospital now. Right? But Canadians believe that it's aliens, that it's something scientific. Once you say alien, outer space, you hear the word space, extraterrestrial, these are very scientific words. And they want to deal with it naturally. Of course, you will never solve the problem.
Yes.
you're on another dimension. The problem is not there.
Can I connect it to because you're talking about aliens and things out of the ordinary, supernatural. So do you consider some of our brothers and sisters who may be going through mental health problems to also be battling some spiritual warfare within them? Is that possible?
That has to be determined case to case. So, because a psychologist who's from a secular institution in Canada would probably say split personality,
Oh.
schizophrenic. They would probably use that and say, oh, we are dealing with two personalities, sometimes this one, sometimes that. For me, as a psychologist and as a theologian, I want to test first whether there's a spirit involved. That's always the first step. Diagnosis. Once you know, then you deal with it at that level, in that dimension. So it's possible. Sometimes there is a demonic dimension,
Yeah.
but not always. Case to case.
Right.
Okay. So Tiong Yao, si diagnosis must be correct because sometimes like the fraud, the Canadian, the Buddhist,
Buddhist
fraud, yeah, 'di ba? And naniwala yung the person that you were saying. So sometimes we also have to be, I think, mindful, no, of what people say to us. In your case, Jen, when did you realize na okay, this is not something normal anymore and maybe I should seek help? Or did someone tell you na, Jen, maybe you need to talk to someone? How did it start with you? How did you realize it?
Siguro in my case, no, it would date back to around 2002 when I lost my dad. A while ago, Ate Christina mentioned about the regulation, about the coping skills, about the triggers. I would say that that kind of played a part in what resulted in my diagnosis. No? So 2002, I lost my dad. I was still in high school. I was around 16 years old. And then looking back, I felt like I wasn't able to grieve because during that time, everyone around me would say, oh, you have to be strong because my mom was very young during that time. So you have to be strong for your mom or you have to parang be someone that your younger sister can rely on. Medyo ganyan eh. And then, so I wasn't able to grieve until probably around 2008. I started to feel parang long periods of sadness. 2008, I was already working. So from college, no, transitioning to corporate life. And then it came again, 2018, when I got married. Of course, getting married is a beautiful thing.
Yeah.
It's something that we would celebrate, but we cannot deny the fact that along with the celebration also comes a lot of adjustments.
Yeah.
Yeah, and then that in my case, I was somehow basically uprooted from where I was. So changed church. I'm now living with my in-laws, and then I also left my work for the past 7 years. I'm in a school, and then suddenly when I got married, I had to resign because I live quite far from the school. So a lot of parang one change after. Actually, it's not one change after another. It's
Sabay-sabay.
many changes
Yeah.
at the same time. Yeah, and then so that was 2018. No? And then 2020, of course, I don't have to explain much. It's a pandemic, so a lot of people had somehow dealt with mental health
Some sort of
concerns.
depression. Yeah.
So it was also very difficult for me. 2022, again, I experienced prolonged loss of motivation. During that time, we had some minor house renovations done. And though I was not the one preparing for that or in charge of that, still there were some form of change in the environment that probably also contributed to me being more anxious. Yan. Then that was 2022. And then 2024 was, I would say, the worst. 2024, I had a new job, no? And then I also, towards going into that new job, there were a lot of adjustments. And then I also had some personal concerns that I was dealing with. So if I look back at all those events that I said, the common factor seems to be that whenever there's a change, there's a transition, I have a very hard time coping with it.
Adjusting.
Yeah, adjusting and coping with it. So changes in life, whether good or bad, like in the case of getting married, it's a good thing, but it's a change still. Yeah. And then of course, after getting married, the struggle with the journey of infertility that also kind of took a toll on my mental health. Yeah. I have difficulty managing changes. I usually get overwhelmed. Probably more overwhelmed than other people would be. A while ago, at Tina mentioned about resilience. I would say that probably if you're going to gauge how resilient I am, I might be in the lower, parang in the less resilient, if there's such a term. Yeah. How did I know that I needed help? Actually, the people around me started to notice na that was 2024, around mid-2024. They started to notice that there were changes in how I
Physical
was.
changes, or-
Physical changes, yes. I lost a lot of weight. And then I also, their term actually is, when they look at me, they don't see any joy anymore. So this was, I think, around September, October. Yeah, September, October of 2024. So they would say that, yun, parang pag nakikita daw nila ako, parang, oh Jen, what happened to you? Parang wala ka ng joy. That was the exact description. So what happened was, there was just a time when I was talking with a colleague, and then I just told her, you know, sometimes parang naisip ko, gusto ko na lang mag-disappear. Tapos sabi niya, ha, mag-disappear? What do you mean? Mag-disappear. And then I said, mag-disappear, mawala na sa mundo. So she got really alarmed. And then from there, she called the attention of a higher up at work. And then immediately, Charlie was called in. And then they did something. So they put me on preventive leave, and then they had to, they told me that I have to see a psychiatrist, have myself assessed, and it was an indefinite leave. So I cannot go back to work unless I get clearance from the psychiatrist that I'm more or less okay to be back already. Yeah. So yun. That's how it came about.
When you were saying that people were telling you, oh, what happened to you? You're losing a lot of weight, ganyan. The person told you from your work, said you have to seek help from psychiatrists. How did you feel? Were you, ano yun, parang, was it easy for you to accept na, okay, may sakit ako, I have to, or was there rejection? Was there, ano yung naramdaman mo nung panahong yun?
Initially, of course, parang I knew that something was wrong. Because I would wake up several mornings parang hopeless, helpless. And it's been going on for weeks already. And then sometimes in the car ride going to work, I would tell Charlie, my husband, na parang ayoko na pumasok, ganyan. I was starting to dread going to work already. And then there were also times when I would wake up, I'm really shaking. And then there were also times na I would think about the problems that I was facing at work and in my personal life. And I would think that these problems have no solution. And therefore, the only solution that I could think of at that time was to end my life. I would find myself actually trying to choke myself in the morning. So nasa bed, ganyan, I would try to choke myself, ganyan. I had suicidal thoughts first, and then, yun, I was trying to choke myself. And then eventually, I found myself also trying to slash my wrist with a cutter. I would wake up kasi in the middle of the night, siguro mga 2, 3 a.m. And then when I go to the restroom, after going to the restroom, I would see on the desk yung cutter, scissors, ganyan. And then I would just go there and say, parang, what if, parang what if I just, cut myself, then maybe parang all these will end. Parang I just don't see the end of whatever I was experiencing during that time.
So because of that, na-realize mo, oy, teka lang, talagang kailangan ko na talaga mag-seek ng help. Because of these things that you were doing.
Yes, because of those things. And actually, the funny thing is, because I needed that clearance, so I had no choice.
External.
Yeah.
External.
So
ganun.
parang, for one, yes, of course, I know that I really needed help. But I was saying, okay, since if I don't get the clearance, I will not be able to go back,
Go back to work, yeah. So,
So,
kailangan mong gawin yan.
kailangan ko
ano?
talaga gawin.
Mm.
Yeah. So, kinda, para siyang na no choice ako.
Yeah.
In a way.
Exactly.
Yeah, during that time. Yeah.
But looking back, were you glad that you sought help from someone? Yeah.
Of course, not everything becomes clearer in hindsight. Of course, during that time, I had a lot of questions. I was beating myself up. I felt like, ano ba yan? I'm such a failure. Parang I disappointed all the people around me. Parang, why did it come to this? Is my faith weak? Like, di ba, what we've mentioned. And then, of course, you would hear some of the people would tell you na depression is a sin. Do not be anxious. Yan, mga quoting Bible
Verses, no? Oo.
Yeah. And some people would tell me also na, kasi you're too hard on yourself eh. Kaya ka naging ganyan eh. Yeah, so those were the things that I had to parang deal with. But now, when I look back, I think it was a necessary season of pruning. And I am thankful that I was made to see a psychiatrist because it's like finally, after all those years of on and off prolonged periods of anxiety and sadness, there's finally parang a name to it.
Yeah.
Diba? They say you name it to tame it.
Yeah.
So, at least I know na hindi ako OA, hindi ako nagdadrama lang. Kasi sometimes I would feel like, ay, baka ano lang ako, baka papansin lang ako, baka nagdadrama lang ako, baka I just want to call attention to myself. Yan. Those were some of the questions that would be in my mind. But when I finally got the diagnosis, actually the first diagnosis back in November 2024 was adjustment disorder with anxious mood. So it really fits, parang I
What
really
you're
fit the
going
bill.
through, yeah.
Oo. Kasi adjustment eh. So when I look back in my life, every time there is an adjustment, every time there is a change, I will be anxious. And then eventually, it became general anxiety disorder. Yeah. I remember asking my psychiatrist when the diagnosis was given, no, yung adjustment disorder with anxious mood. Sabi ko, pero doc, di ba normal naman yun? Sabi niya, disorder nga eh. Disorder means there is something wrong. Because siguro in my heart of hearts, I wasn't ready to accept that there was something wrong.
May denial pa.
Yeah,
no?
may denial. Yes. Ayun. So, ayun, parang that was, the diagnosis I would say is like a painful relief, if there is such a thing. Parang it's painful, yes, but at the same time, it's a relief because you know that you finally know, okay, ito pala yung reason. Ayan. So,
Kaya nga nasabi nila, no, the truth hurts, no?
But sets you free.
Yeah,
Yes.
but it sets you free,
Yeah.
correct.
Correct.
So contradicting, no? At si Christina, maybe you can share what can the people around, like in the case of Jen, no? Yung mga tao sa paligid niya nagsabi sa kanya na, "Uy, Jen, ganyan." And they experience rejection, they experience denial. ano ang pwedeng gawin ng mga taong nakapaligid sa kanila to offer support? Especially the people that are very near to them, family, husbands, sisters, ayan, mga
Yeah.
parents.
Yeah, that's a good question, no? Well, first, no, to help somebody who is struggling emotionally, psychologically, it's very important for them to feel seen, you know?
To feel seen.
Yeah, because nakakapagod yun trying to put on a mask, no? Trying to appear cheerful, trying to appear okay when you really are not.
Yeah.
It takes a lot more effort, and that can really drag the person down much faster. But if they know that they have the permission to feel sad when they are sad, to show their exhaustion when they are really tired, that alone, no, is very helpful. No? I remember there was one Christian who, after a long day of ministry, went back to his or her cubicle, and he was really tired. And a good friend, well-meaning friend, said, "Why are you like that?" It's like, "I'm exhausted." "Why are you exhausted? We're doing God's work. So, when you don't have the permission, that can put you at risk. No, then you're forced to be somebody that you are not. You have to pretend to be strong when you are not. So that's the number one. So I thought that it was very, very, very nice of Jen's colleague to notice. No, to notice that noticing is very important. There is comfort there, that you notice that I'm especially quiet today, or you notice that I'm especially sad this past week. There's comfort there, actually. But then after you notice, you don't act like, why? Why are you like that? Parang, we should not act like that. No, instead, a good friend would actually say, maybe it's time to consult a doctor. Now, what a good friend can actually do is to accompany the friend, okay? If, or at least, ask around, if meron silang ma-refer na psychiatrist. Because when a person is really depressed or clinically anxious, they don't have energy to even, look for a doctor. And so if friends can offer, these are what they call practical helps. Don't worry, I'll ask my friend at baka may kilala siyang doctor, or my friends can recommend. Helping them with those, like looking for a doctor pa lang is a big thing na so practical help. Of course, the other practical help is samahan kita, you want. Malaking bagay yon. Especially if the spouse, if you're married, sometimes some spouses are on denial din no? So, natatakot sila, mag-isa sila. So if you can offer practical help, like offering to take them to the doctor, that would be good. That would be very, very helpful. Of course, another practical help is to share some resources. And there are many resources out there. Although people who are depressed, they don't have the energy to read books then. Okay? But maraming podcast ngayon o maraming mga short reels, which a decade ago wala
Right.
So you can share those those reels, that they can listen to, because at least na-enlighten sila and na-inform din sila. It can help them understand what they are going through. So those are some of the things that or bringing them to a counselor. Some people are very scared of, or very apprehensive, very hesitant to see psychiatrists. Then bring them to a good counselor. A good counselor can assess kung kinakailangan talaga ng medication or not. Because counselors are trained. If the person is already non-functioning, then you know that he or she already needs medication.
Correct.
So the counselor can give advice. can suggest to see a psychiatrist when needed. But if the counselors or the therapists thinks that kaya pa ito ng ng counseling lang, no, support therapy, then they can observe the patient for say 1 more month or 2 more months.
Yeah.
And then we assess, no, kung talagang kinakailangan ng psychiatrist. So these are some practical helps that we can do to support. What is important is that we don't act like this is something shameful.
Yeah.
Yes.
We don't act like this is a failure, you know. Christians are not supposed to feel sad. Christians are not supposed to be depressed, you know. When I mentioned about faith, yes, you know, if you understand faith can be a very good inner resource, you know, faith in God. But provided you have a correct understanding, no, of how we are designed, no.
Yeah.
The brain is just like our kidneys, just like our gallbladder. It can get sick too.
Yeah.
No? So if we are abusing constantly our body, like a lot of young people do now, is they can stay up until 2 or 3 in the morning, and wake up at 6 to go to school, and having only 2 or 3 hours of sleep. What do you expect? No, like what Boksu said. Maybe 1 month kaya mo pa. Let's see if 1 sem you can survive like that. No, whether you like it or not, whether you are a Christian or not, you will get sick talaga. The brain will get sick. It's not getting the proper care it needs, no, in order to stay healthy.
Correct.
So we cannot abuse our body like that.
Talking about reels, no, Doctora, how do you think has social media played a part in the cases of mental health cases now? Dati ba dahil hindi pa masyadong sikat yung Facebook or any other social media platform, mas wala ba talagang cases? Or dahil may social media na ngayon, mas may awareness na? And at the same time, what are the negative effects of social media to a person who is going through mental health problems?
Okay. Actually, I wanna digress a bit na what we're doing here, like having a podcast, no, in a like church, inside the church, no, is kind of a big deal. It's
Yeah.
kind of revolutionary din, parang breaking the stigma, because sabi nga natin kanina, the help seeking is hirap.
Yeah.
Hirap for us to do. But when we sit down with like Christian people talking about their faith and their struggles, that also encourages another person na who might be hiding, who might be ashamed to
Yeah.
ask for help. No? So in this case, syempre mapopost sa social media, it's helpful.
It's helpful,
It's
yeah.
gonna be helpful. Reels, sabi ni Ate Christina, they're helpful also to gain awareness or minsan tips on how to handle mga intense emotions, ganyan. With regards to increase in the mental health cases or conditions, and did the awareness cause the increase, no? I would say both. It's both ways, no? I believe there is an increase talaga in mental health cases, especially post-pandemic, no? Yun. But the awareness also is a good thing in that yung mga tao naging aware sa feelings nila, mas self-aware sila, mas kaya nila try mag-help seeking, mag-see ng mga resources, no? Mag-ask for possible treatment interventions, no? So, yun yung awareness, good awareness, no? Paano naman siya nagiging detrimental,
Yeah.
yung awareness? So, sa iba, unfortunately, yun, ginagamit yung mental health card for mga, yung kunwari, gusto kong magbakasyon, ganyan. So, gamitin ko yung mental health card ko para makalib ako. Parang may mga ganon, di ba?
Oh.
Yeah. Or, paano ba naging detrimental? Sometimes then, like, pag nabasa mo, this is so me, meron akong ganito. So, kahit yung mga normal daily stressors, baka inis ba, oh, I'm so ADHD, I'm so depressed, kahit wala namang formal diagnosis, no? Ayun, yun yung mga ways that they're detrimental. And, syempre, yung reels, no, 2 seconds, 3 seconds, parang it also lowers our attention level, no? And our impulse control, our focus. Kaya ngayon, di ba, parang iba, parang, what's the point? Parang, yun, we cannot sustain. and just, talk and spend time. Parang pare tayong on edge na.
Oh, ano, what's next? What's
yeah,
next?
yeah,
Yeah.
yeah, yeah. Parang gano'n. Hindi tayo ganyan. Yan.
You know, Jane, if I may add, no, Australia is the first country to actually ban social media, no, for children 13 years old and below. And now Spain is joining a group of European countries, no. They are seriously considering doing the same. And of course, there are many arguments, but one common argument is that children this young, 13 years below, 16 years old below, they are exposed to so many digital content that developmentally they are not ready to handle. They're not developmentally equipped to manage them. So it becomes harmful. You know? It becomes harmful to them because it's too much. They are not there yet developmentally. You know, their brain has to, for brain to be fully developed, you have to be at least 24 or 25, right? So your brain is still very underdeveloped, and yet you're already exposed to all kinds of digital content, good and bad. Okay, both good and bad, and that's too much. This overstimulation is harming them.
Yeah.
You know, and when they're overstimulated, it affects their mental health. Okay, plus it is addictive in nature.
Right.
So when you are addicted, then we develop a relationship with our gadgets. So we have less need for real human beings or human connection. Again, that goes against our design. As social beings. So everybody is on their phone or on their gadgets, and kids this day have to be taught, literally have to be taught how to start a friendship, how to sustain a friendship. You don't teach them, they do not know how to.
Yes.
So these are some of the things that we're confronted now that a generation ago doesn't have to face.
I guess it goes to say that when we're dealing with mental health, no, it's not just about emotions, no. So it's a holistic
Yeah.
approach, no. So you have to prepare your mind, make sure you feed your mind with good stuff, no, and you do not abuse it. At the same time, a while ago you mentioned about nourishment, ganyan. Jen, ikaw, ano yung mga ginawa mo looking back as you cope through this disorder, kumbaga?
Actually, I would say at the height of the ordeal, wala akong nagawa. I wasn't able to. I was really so helpless, so hopeless, lifeless, actually. The word is lifeless, I think. Because I would find myself in two extremes. It's either I would always be asleep or I will always be awake. So, dalawa siya. I remember Charlie would go home from work, no? Nasa kama ka na naman, tulog ka na naman. Parang during that time, of course, medyo he
He doesn't understand.
he doesn't
why.
understand yet. Yeah, he doesn't understand yet. So parang, tulog ka na naman. Pag alis ko, tulog ka. Pag balik ko, tulog ka pa rin. Because during that time, I felt like sleep was my way to escape reality. So, I just wanted to sleep and sleep and sleep. But ang ending, since I sleep and sleep and sleep, sa gabi, hindi naman na ako makatulog. Kasi wala na eh. Naubos na yung antok ko eh. So, during the time that I was supposed to be asleep, I would be awake. During the time that I'm supposed to be awake, I'm asleep. So, di ba, gulo-gulo na lahat. And then, I would notice that I'm really so different. And all the people around me would say that. No? So I'm unusually quiet. When you talk to me, parang walang sense kausap. Cognitively, I also felt the difficulty din processing things. I love writing, but at that time, even when my psychiatrist would tell me, I have to journal so that I can cope with what I'm feeling. Would you believe I was not able to even write one coherent sentence.
Yeah.
As in, the words just wouldn't come out.
Yeah.
So, given all those things, no. Also, one thing that I I remember vividly is I like watching K-drama. So there are scenes in the K-drama wherein a person with depression is depicted this way. No? So you go inside the place where that person lives, maybe a condo unit. And then, sobrang kalat. No? Parang may bottle of soju, may mga parang cup noodles, something na nakakalat
Balot
lang
ng
dyan.
chips, ganyan.
Yeah, mga ganyan, di ba? So, there was a point when it was somehow like that also in the room where I used to do my online teaching. But it was not it was not mga garbage or whatever. But it was mga gifts nung Christmas of the previous year.
Na hindi mo pa nabuksan.
Na, yes. Yung iba nabuksan, yung iba hindi. Pero nakalagay lang lahat sa table hanggang sa ang kapal na ng dust and all. And nandun lang. Parang there were a lot of times when there was an urge to, ayusin siya and all. But there's like somehow parang a force pulling me back na, hindi, wag mo na yan ayusin para, if you one day decide to kill yourself, then nobody will be able to discover that you're dead. Kasi nandyan ka lang sa kalat. So it came to that point. And ngayon, parang looking back, so totoo pala yung ganun, no? Kasi when you watch the K-drama, parang feeling mo it's just an exaggerated depiction. But when you experience it, parang, okay, so it's really like that pala. Na you would try so hard, well, at least for me, I try so hard to fix those things, but it never got fixed.
Yeah.
Ayun. Yeah, so that was parang a part nung nangyari sa akin. And then March of last year, 2025, I had a really bad breakdown. So the day before, we actually went out of town with workmates. Parang we had a recreation day, ganyan. So sobrang happy, ganyan. And then the following morning, sobrang down. To the point that I was shaking, I kept crying, and then I was telling Charlie, parang, how will I end my life? Parang, can you tell me how I should end my life? Should I parang get a knife? Should I cut myself here? Should I stab myself? And then I remember days leading to that. There were some triggers also. And I attempted to cut myself. But what stopped me was actually two things. One thing that stopped me is pag namatay ako ngayon, hindi na ako makapagkape.
And
It's
because
funny,
you're a
no?
coffee lover.
Yes,
Yeah.
it's funny kasi you would, I don't know, parang minsan inisip ko, syempre if you're at the brink of, ending your life, ang maisip mo, paano na yung family ko? Paano na yung ganyan? But no, it was just, nako, hindi na ako makakapagkape. That was one. And then the other thing is, during that time when I was trying to cut my wrist, I was thinking, shucks, hindi ko alam paano ba? What is the proper way to do it? And since I didn't know the proper way to do it, I might end up
Not doing
not
it
dead.
properly. Yeah.
Yun, oo. So that was what stopped me. Parang, if I don't do it properly, I will not end up dead. Parang all this effort and I will not end up dead. Parang, never mind. Because chances are, I might end up siguro in the hospital, and then I will burden everybody to take care of me. I would just worry everyone. And then I'm still alive. Parang, never mind, wag na lang.
So what are the things now that you're doing? Sige, let's move to the
Sige,
now. Kasi dati sabi mo, wala kang nagawa kasi
Wala eh.
hopeless,
I was
lifeless.
really, yes.
Pero now, ano na yung mga ginagawa mo to help you to the
To cope.
road to recovery?
Yeah.
If that's the right term, yeah.
That time, actually, I started to take medication. But after taking medication, it was also not easy. Kasi the meds are so tiny. Pero after I took it, parang ang linis eh. That was how I would describe my mind. Parang ang linis. Feeling ko wala akong naiisip at all. And then, my emotions were very suppressed. So, I will not feel sad. but I will not feel happy either.
So you felt nothing.
I felt nothing. So, naturally, I'm animated, I'm OA, ganyan. Pero during that time, parang even if something, let's say, something that would usually excite me, didn't excite me at all. Parang, masarap yung food. Parang, magkikita tayo bukas. Ganun lang. That's not me. So, it was also very difficult at that time. And I took meds for March, April, May, mga around 4 months. Yeah. And then when I stopped yung meds, it's a different struggle din kasi parang I had to deal naman with withdrawal. Right now, I manage with strategies that I learned from my psychiatrist, from my doctor. So number 1 is awareness. Awareness meaning there are bad days, but a bad day is not a bad life. Parang yun yung inano sa akin, tinuro sa akin. And at the time when it was very difficult, no, whenever I see my psychiatrist, she would tell me, okay, Jen, every morning you have to tell yourself, do not die today. Bukas na lang. Every day. Every day. So sabi ko, parang ang weird, no? Parang, wag ka muna mamatay ngayon, bukas na lang. Pero kasi, that was all that my mind can take.
Yeah.
I cannot even think about what will happen tomorrow. This is literally one day at a time. So, sabi ko, okay, so if I tell that to myself now, how about tomorrow? Tomorrow morning, if you wake up, you tell
Say
yourself
it
again.
yeah.
Okay, hindi ka mamamatay ngayon. Bukas na lang.
ulit. Yeah.
Bukas na lang until I'm still here right now. Yan. And now, I don't tell myself that anymore. Na wag ka mamatay ngayon, bukas na lang. Hindi na, at least, di ba? Yeah. So, awareness, you have to pay attention to the signs. No? So, of course, right now, there are still days na I will be in a low mood, ganyan. So, I would be aware, and at the same time, I will not suppress. Kasi I think my problem, no, when I went through the several sessions of therapy is that all my life, I've been high-performing, I've been a high achiever, a people pleaser. So, it's really rooted on, I have to do this, I cannot be sad. When I'm sad, everybody will be sad. Parang there was so much pressure that I was giving myself. It was a very unnecessary pressure. Yun. So that's why during the first few sessions, what was done is really to anchor me on my identity as a child of God.
Yeah.
That whatever happens, no, kahit matanggal yung calling, matanggal yung being a teacher, being a writer, being a speaker, being whatever, at the root of all of it, I am a child of God. And the unconditional love of God is there. Yan. Yun yung parang pinaka naging anchor ko eh. Openness also helped. I had to speak up. I had to tell the people around me that, I'm dealing with this, ganyan. And not be afraid that people will judge me. Yan. I'm blessed because there were people who would tell me na, Jen, sa totoo lang, I don't understand what you're going through. But I'm willing to pray for you.
Yeah.
Or, honestly, I don't understand. Can you tell me more? And then they would listen. So those are the things I think that helped me cope also. Then some practical strategies to manage, like the breath prayers, breathing techniques. There was a time yung cold shower helped me.
Nice.
Mga ganun, mga practical stuff
Yeah.
that I think are not, a lot of us are not aware that those little things would actually add up. Yeah. And then, going back to what I love, dancing, writing, all of these things. Parang it really helped me. Hobbies. Basically, hobbies. I would really joke around, I would say na yung fangirling really helped me to find parang an outlet eh. Kasi sabi ko nun, when I started to be deeper in my fangirling, in K-pop, ayan, I love the group Stray Kids. Tapos sa P-pop naman, I love the group SB19. Parang And then I would read about their journey, ganyan. Parang there are a lot of parallels, yung not giving up, resilience, and
Yeah.
everything. Parang, okay, oo nga, no, ganyan. Parang sobrang nakaka-relate ako. And then I would tell Charlie, ganun pala, no? Ngayon, at least I know na when I am in so much pressure, in so much stress, hindi ko kailangan patayin yung sarili ko. Kailangan ko lang manood ng video.
There are avenues for you to,
There are outlets that I can have. And then siguro that time, when I was starting yung sa journey ko of healing, what kept me alive is, ang dami-dami palang videos sa YouTube, no? Parang, paano ko matatapos lahat panoorin yung mga content nila pag namatay na ako? Ayun. And I think one of the things also that helped me is I was able to reconnect with some of my good friends from my first work. And then this one good friend of mine, over lunch to eh. So, they listened to me as I told my story, ganyan. Tapos, after nung lunch, sabi niya, wag ka muna mamamatay ha, may next meeting pa tayo.
Yeah.
So parang yung,
Yeah.
of course, if it came from somebody that you're not close to, parang ang offensive naman. Pero because we're very close, parang yung statement niya na yun, parang kind of gave me an anchor, I
Yes,
guess,
an
na
anchor.
okay, hindi pa ako pwede mamatay. And then the other friend, parang affirmed na, oo nga, Jen, kasi ikaw yung nag-organize ng meet-up. Isipin mo, pag namatay ka, hindi na kami ever mag-meet up. Sabi ko, okay, salamat ha. Pressure ha. But yeah, those are some of the things then that really helped me. Yon. Kasi at that time when I was struggling, when I was in the ordeal, I would really find myself isolating eh. Kasi I think that is the enemy's work eh. The enemy would really make you feel like you're alone, nobody loves you, nobody cares for you, all of these lies. But in reality, you're not. You're not alone and you're not the only one suffering. Yan.
Where is Charlie before and where is Charlie now? So just to give a perspective for our listeners, no, do sa mga companion, yan, sa mga companion nila, how do they play a role during the time that you're going through this and then now that you're on the road to recovery?
Honestly, no, Charlie and I are very different in a sense na I'm very emotional, I'm very sensitive, I'm very OA. Charlie is grounded. I would say that his faith is very strong. And he is resilient. He's also very secure. He is definitely not a people pleaser. Very opposite. And I praise God that we're different. Because I cannot even begin to imagine if he is like me. So pag na-depress ako, depressed din siya. Wala na.
Pareho
Depressed
kayo.
na lang kaming lahat, di ba? Parang wala na, hindi na ako naka-recover ever. But by God's grace, honestly, during the first month or so, no, he was, of course, trying to cheer me on na, hindi, kaya mo yan. Parang he has seen how I was before. No, especially siguro in terms of work. Parang, bakit mo sinasabing hindi mo kaya? Kaya mo yan. Di ba nagawa mo na nga to. But at that time, it was really so difficult for me and I was really getting frustrated at myself.
Yeah.
So, I felt like parang the push na kaya mo yan was not actually helpful at all.
It became a burden for you ba?
Oo.
Yeah.
Parang, hindi ko nga kaya eh. Hindi, kaya mo yan. Hindi naman ikaw ako. Hindi talaga. Hindi ko talaga kaya. I felt something to that effect. But I praise God because throughout the journey, He has been so patient. At times, He will show me tough love if it's needed.
Yeah.
And at times, He would just hug me and comfort me and listen. And siguro what I would say all throughout the journey is that He never stopped praying. Praying for me and praying with me. And that, I would say, is the most important thing.
Yeah.
That we didn't go through the journey na kaming dalawa lang eh.
Yeah.
We went through it with God in it.
Yeah.
And I would say that it would be impossible for us to have survived that season if not for God's presence and for God's provision for us. Kasi yung, I know how difficult it is, especially now that I look back. Parang may times He would parang reenact how I am during that time. Parang, talaga ganun ba ako? Oo, ha? Yan. So, hindi ako makapaniwala na I was like that.
Yeah.
Parang, and right now, you would see me. Parang, I did not, to borrow the words of the psychiatrist that I saw, no, I did not just bounce back to who I was before, but I emerged stronger.
Yeah.
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 That I think is a very beautiful thing.
Yeah.
Na God used that brokenness, God used that rock bottom experience for me to be able to move forward.
Yeah.
Yung the people pleasing, yung parang pressuring myself, the being a high performer, all of those things were channeled into something positive.
Yeah.
Yan.
Thank you, Jen, for being so open, no, and honest with your experience. Boksu, if I may ask you, a while ago we were talking about, we were saying terms like intrusive thoughts, no. These intrusive thoughts may or may not be used by the devil to attack our faith. Can you correct me or verify if what I said is correct? Can it be used by the devil? These intrusive thoughts to further deepen our yung pagka mental health, yung problem natin, yung disorder natin. Can it be used by the devil?
Yeah, just a quick comment before addressing that question. I kind of read that when Jennifer was going through her mental health issues, struggle, she did not lose faith in God.
Yeah.
As in, I don't want you anymore, God. Is that
Yeah.
right?
Yeah.
So a person of faith can actually have mental issues.
Yes.
Just like a person of faith can have cancer
Yes.
or, surgery needed. Yeah. I think many people sometimes say, I hear voices. So the natural tendency for secular psychologists is to imagine that it's all psychological.
It's all in the mind.
Yeah, it's all in your mind. So we can deal with it by this technique, this coping mechanism, that coping strategy. So they will probably come up with that. But it appears that sometimes those voices are supernatural.
Okay.
Again, you have to diagnose case to case. You cannot assume. But secular psychologists, they just assume because they don't operate within the supernatural. They only operate within the natural.
Okay.
So it's all psyche, within the human psyche. Nothing to do with a world that the eye cannot see.
Yeah.
So as a Christian, I would first want to know whether these voices are indeed just from within or coming from the outside to them. I think I not long ago talked to another individual who actually hear voices. And the voices basically suggest to him to destroy, I'll just use the male gender for now, just basically suggest to him to just kill himself. Just harm yourself. Just harm others. Just kill yourself. Just give up faith. So the way the conversation is happening, it's not natural. There is an evil force working. And the voice is actually telling this man, who's a very big man, he's very strong and healthy, but he was addicted to substance. And so, his life was messed up. So I met him in a rehab center, actually. Okay. So he has these voices coming to him and says, don't believe in Jesus. Don't pray. These are religious. So I kind of suspect. So eventually I told the officer in the rehab center that, not directly, I told it through a friend, that maybe he needs to see a pastor. Because it seems the tendency there is to make him lose his faith or just finish his life.
Oh.
That's all. So that kind of agenda seems to be quite demonic.
Yeah.
So the way he tells me, and he thinks that it's just voices. He thinks that. He's a new Christian. So, So I feel that, there are times when we just have to discern first before we actually
Yeah.
start the so-called prescription,
Yes.
prescriptive action. Need to do that. So yes, I believe that things like that happen because I have encountered some of this.
Now, let's talk about for someone who's a Christian, maybe someone who has been in faith for many years, no? Tapos bigla, we don't know, bigla may nag-trigger and then na-depress and then hears these voices, all these intrusive thoughts, and then gives in to those intrusive thoughts to the point of killing himself. The question is, will that Christian be able to go to heaven?
Before Boksu answered that question, he's the best person to answer that question. I felt that I need to share this. Is in psychiatry, it's a doctor's and Doctora Iris can say more about that. They have to assess whether a person's depression is how to assess the severity of a person's depression. Pag sobrang severe kasi, sobrang severe, clinically depressed, and sobrang severe, meaning to say you have really not, you have remained untreated for a long time, and things got really so bad. It's very possible kasi to cross over to psychosis.
Yeah.
So you start to become psychotic. So psychotic one is hallucination, one is delusions. So when a person cross over to psychosis, then they start to hear all kinds of voices.
Right.
Okay, so it is a psychiatrist's call to actually prescribe antipsychotic medication. And once antipsychotic medication starts to do its work, the hallucinations will disappear. Yeah. But I must say that the spiritual aspect, the demonic, is impossible. Absolutely not. You know, you've heard me say this before, that the enemy can actually take advantage of our psychological vulnerabilities.
Yes.
Okay, so what started out as a psychological weakness can become a spiritual issue, especially if in your desperation you double now with the occultic, right? And we know some Christians would go that far also. Kung hindi man sila, yung relative sila, right? Either dalhin sa abularyo or, for the paypay, meron silang mga rituals. So, we are aware of both realities. But I just felt like, for the sake of our audience, I think it's important for you to know that sometimes in order to prevent a patient from becoming psychotic, the doctor will not just give you an antidepressant, he would also give you an antipsychotic medication, right?
Yes. Thank you for elucidating. Very interesting. I'd also want to add, but not psychiatry. I'm gonna divulge a bit from psychiatry, but intersectionality. That term just parang came to me. There's really intersectionality between spirit and mind and body. Like right now, we're body, but I'm thinking of something and my spirit is here. And you cannot chop it like my spirit is weary. I mean, sometimes my state of body will affect my mind and my spirit. So, maganda yung sabi ni Achi Christina na there are psychosis that presents as commanding suicidal hallucinations, like destroy yourself, kill yourself, and they can be addressed by antipsychotics as well, no? But there are also, what Pastor said, the discernment, I think is very important because, like even in the Bible, I think there were mentions of the demon will throw him into a seizure, right? Seizure is a medical condition, but it's the demon who caused this person to have a seizure. And then it will, sabi niya, how come we cannot like cast this out? Because it's done by prayer and fasting. So even sa psychiatry, there's now emerging knowledge that the treatment should be holistic. It should involve biological intervention, psychological, social, and also spiritual. No? So apat yun na dinideal. So kaya nga, di ba, yung tanong natin ka dyan, how do you recover? You address also this
All these
biological,
aspects,
psychological,
yeah.
social, spiritual. So there can be intersectionality. No? Parang ganyan.
Yeah. Okay, going back to the big question, Boksu.
Yeah. So basically, the question is, what sin or sins cannot be forgiven?
Right. Right.
The fundamental question is that. Is suicide a forgivable sin? So let's say I'm a Christian and I'm okay, but one day I got into an intense situation where I became so angry. And so I just decided to drive my car into the crowd. And then I died, everybody died. And the moment I died, I regretted, but I'm already dead. Will that sin be forgiven? In the Bible, we're told that the blasphemy of the Holy Spirit is a sin that cannot be forgiven. At the moment of death, some people did not confess all their sins
Yeah.
because death came so suddenly.
Yeah.
So God is not a strict punisher that says, "Haha, huli ka. Now
Wala na.
you're out na.
Yeah, out
So,
na. Yeah.
I have one free slot." Walang ganon. No? So I think God is merciful. People don't commit suicide for no reasons. Usually there's some intense struggle before you get that stage na I want to end everything.
Yeah.
At first we try to resist, we try to deny, we try to escape the situation,
Yeah.
or we reduce our time in that particular situation. We try all kinds. Then finally, when there's no counseling help, I'm on my own. I thought maybe the easiest way is I just jump off the roof.
Yeah.
I actually have a Singaporean friend. He used to be a gangster and a medium in a temple where spirits come, medium. And eventually, he became a Christian. But before he became a Christian, his life was so messed up, he wanted to commit suicide. So he went to one of the high buildings and stood at the edge. And then he looked down and says, "Oh, ayan kuya." So he went home. Ang taas pala. Totok.
Buti na lang.
That's what I was gonna comment, Boksu. Isn't it a natural thing for you to try to save yourself as a human person?
The survival instinct.
Yeah, you have
We're
survival
given
instinct.
survival instinct.
So I wonder what is going through at the mind of a person. Maybe you want to share something.
Can I just add, no? Actually, what I realized is people who would openly say that they want to commit suicide. Well, I cannot speak for everyone, but at least for myself. During that time, when I kept on saying that I want to die and actually attempted to, it's actually a loud cry for help that I do not want to die.
It's really the opposite.
It's the opposite.
Yeah.
Parang
Right.
the fact that I was quite vocal about it, that I want to disappear, I want to die. It's because I really do not want to die. But I just didn't know how to live. I didn't want to die, but I just didn't know how to live. Meaning, the problems at that time were so overwhelming that I really cannot see the end of it. So my only solution is, maybe if I die, then that's the end. But in reality, I would say that I didn't want to die, but I just didn't know how to deal with all the problems I
those
was
things,
faced
yeah.
with.
Intensity. It intensifies until we say maybe this is the way out. You mentioned about social media.
Yeah.
So social media can be a trigger.
Yes.
When something fails to cause something, we don't call it a trigger. Trigger means it succeeded. The both succeed, it's not a trigger because nothing happened.
Correct.
But it's just a possible trigger, potential trigger. So social media, it seems, tends to affect some people who are insecure and affects people who are dissatisfied. When we say insecure, it means that there's something not right about me. You know, dissatisfied means that I'm pretty good, but not good enough.
Yeah.
So it's another level of condition. Insecure is I'm no good, I'm not good enough. They're all better than me. Dissatisfied is I'm pretty good, but how come he's better than me? I want to be number one. Now I'm number two. So different levels ko. So social media, say the intensity because of the massive input. Example lang. An old person living in a senior home in Canada. Canada, you know, people go to senior home. He's always very depressed. Why? Because everybody always have somebody visiting them except me. Monday, visitor. Tuesday, Thursday, Wednesday, Thursday. Maboa. Actually, those are different visitors. They all got one visitor a week. Except that you see visitors all the time. You also got one on Saturday. How come they have it every day? No, they did not. They have it once a week. But the appearance is like, kana tiya o visitor, puro boleh tham gua. Kagwa ay lai chide lang. Ima si chide? Oh, so there's an illusion there.
Yes,
Kind of
yes.
deceptive kung, oh, I'm so miserable, bolang, bo, tiya ulang. Bola, ina si chile, pay chipay lang. It's the same lang, the same. So social media is like that. You will see so many people better than you, went to holidays nicer than yours, with all this new bracelet and, you know, earrings nicer than... Actually, these are many, many different people. The one who has the better earring than you may not be more beautiful than you.
Yeah.
So, na-compare, talo siya, di ba? Pero di pwes yung ano, wah, iyasui, wah, iko, chong tao, mga ne. So then,
Tagay ako nga hi.
everybody's so happy. You know?
Everybody. Yeah.
So, if you're insecure, you become more insecure.
Yes.
And if you're dissatisfied, you become more dissatisfied.
Yes.
Siya kasi aggravate na. There's an existing condition, but it worsens. It intensifies. So, siya kasi aggravate. Aggravate ka, it might become a mental issue.
Yes.
Because you're so fixated on that dissatisfaction or that insecurity or that jealousy that you're not happy, and then you don't see the nice things, and then you think of ways to beat them to become number. Yeah. So social media, see here the intensity is so massive. They don't stop. Every time you open it, it's there. It's not like a friend you call, nobody's answering because she's asleep. 24 hours. And then you have 1,000 million guys sending in a material. So of course, overwhelmed.
Correct.
So sometimes it can be a trigger because of that. But then there may be an existing condition that aggravates
Within you, no?
until reach that level, then you're not happy, and then you become depressed, and then blah, blah, blah.
People who become people pleasers, they have very high
Tendency.
they have very high chance of developing mental health issues, because you have to understand that at the heart of people pleasing is a loss of one's authenticity, one's self. Self is God's gift to us. It's sacred, you know. Without a self, what do you love God with?
Right.
Without a self, what do you serve God with, right? That self is for us to discover, and but parents are supposed to help us know ourselves, to discover. Parents are supposed to be good mirrors to help us.
Right.
You know, as we grow, we get to clearer, more accurate picture of ourselves. So, but when we this depends on the family dynamics, right? There are some families where ginauhi bo chui, right? And you cannot have other opinions, you know. So when we become people pleasers, when all we care is to satisfy the adults in our lives, when we always care about image and how we look, how our family should look, then we start to lose ourselves.
Yeah.
You know, we start to lose ourselves. So once we lose our authenticity, a lot of things can start to go wrong. Na.
Yeah.
Okay. So that is something very, and that's what also happened to Jen. So this whole emphasis on performance and achievements over self-acceptance,
Yeah.
okay, is what we see quite a lot these days. But if we are true followers of Jesus Christ, and I'm speaking now to the parents who are watching, we are God's representative. We are the first God image of our children. It's very important for our children to feel accepted. We have a very accepting God, full of love, full of grace, and not just truth, full of grace as well. So it's very important that when a child is developing his sense of identity, that we are able, with God's help, of course, we're able to actually help the child accept, accept themselves, both their strengths and their weaknesses, and as a foundation of their future adult personality.
Yeah.
Right? So it's very, very important. The self-acceptance is very important. When we can accept ourselves, then we can, of course, no, kasama na doon yung self-awareness, then we know what makes us happy. What is it our nervous system likes, when a person is depressed, a very simple thing like, just do one thing that makes you happy. I don't care if that's mababaw. If it makes you happy, just do it, right? So, if you do not know yourself at all, you don't even know what makes you happy.
Right.
You do not know. And sila yung talagang pitiful na.
Yeah.
Have to think of it, You are an adult now, but you really know very little about yourself. So it's very important that and the Bible is supposed to help us, no? Through constant practice of self-reflection and the community acting as good mirrors, helping us see who we are, that should help increase our self-awareness so that we know how to cope. Your nervous system is different from my nervous system. What works for you may not work for me, right? When you do exercise, you get better. Sleep, when I do exercise, wala na, right? So, kanya-kanya tayo. But bottom line is, get to know who you are, because this is God's gift to you. And you want to take good care of your body because this is your gift to God, right? You don't just take care of your spiritual life, you take care of your physical body, your nutrition. Nutrition, diet plays a big role in mental health, So the latest sub-discipline in psychiatry is nutritional psychiatry, because a lot of mental health, like particularly mood disorders, can be addressed with proper diet. So poor diet can cause poor mental health. And that is why many Filipino children, they have very poor mental health because of lack of nutrition. Okay? We have so many school children who live below poverty line. They're not getting enough nutrients. So they're stunted, and mentally, everything is affected.
I'm just curious, Ate Christina, and maybe for you also, Doc. In terms of demographics, what age group do you mostly handle? Is it youth, or do you also handle people who on the older age who also suffer mental health problems?
I handle kids also, and majority are adults, young adults.
Young adults.
But I also have people who are in their 70s. I have two in their 80s as well. Maybe because I can speak Chinese. Okay. So they can share their
Their concerns, their problems, no? Yeah.
Okay.
Do
It's a
they
lao
know?
lang ho, lao lang jingko to, ha. And they felt that because their children are all busy na, no? And they have so much they want to take it out. So they also need counseling. They need somebody who can listen to them and validate what they are feeling. They're not being OA, but sometimes they are made to feel they are too OA.
The
That's why
same with-
daytime functions for seniors are important,
It is.
because they are bored and
Right.
lonely.
Right.
There's
Yeah.
no one to
Right.
talk to.
Right.
So
right.
they want to go out and meet peers.
Yes.
What happens now is that some churches do it once a month,
Oh.
gathering for
Ganda.
seniors.
That's
Fortunately,
nice.
many churches are doing it.
Yeah.
That's
So
nice.
it's like they're taking turns, sort of like that. It's not
that's
unplanned,
nice.
but it's something like that. But I noticed that old people, they like to go.
Yeah.
And it doesn't matter what the program is or what the food is. Basta they know it's people who look like me will be there. So, okay na.
My mom used to attend that. Used to attend that. And when she developed Alzheimer, she still tried to get ready every week.
Oh, that's
that particular day. Because as far as she can remember, at least the long-term memory is I'm supposed to go to Lao Lang Hoi.
Right.
They don't
That's
forget
nice.
it. Okay, so their body adapted to it na. But old people need that. So the children, the old people, they need that too. Children is because they cannot articulate their subjective experience, right? But through play, they're able to express, okay, what they are thinking, what they have experienced in school, and all that. So there's a place for that, And thankfully, the Chinese community, the Chinese churches, we're now seeing more and more pastors recognizing the place of counseling. Before, they used to be very suspicious of counseling. They just dump everything as these are all humanistic, but those are old school of thought na. A lot of things have changed, and right now we want to see the integration of psychology and Bible.
Yeah.
So, in fact, I often say that God does not give Christians a monopoly of truth.
Right.
When we have the humility to try to seek truth from different disciplines, and then
Yes.
come back to read the Word of God, everything becomes crystal clear. Everything becomes more meaningful. And I have counseling students who said, Mom, since I took counseling, I don't read Bible the same way again.
Yeah.
Before, when I read about flesh, Paul talks about flesh, I don't even understand what that means. But now I really understand what he means by flesh, because now he understands, human behavior in a much deeper way. So that's what we really want to see, no? And as more people become equipped in both the Word of God and in people helping ministries, then we can be more effective, actually. Because our approach then becomes more holistic. We are not simplistic anymore. Neither are we naive.
Yes.
To think that everything is basta nakikita lang tsuelo, just pray lang, sounds spiritual, but too simplistic. Okay.
Thank you for mentioning that. No, it's really a collaborative effort. No, when you said you learn a few things from different disciplines. No, but to both of you, Doctora and Ate Christina, because you're the ones who always see these people. Maybe for Boksu also,
Boksu too,
for
yes,
those who go to you to seek counsel. How are you? I mean, with every single day that you see maybe, 20, 30 people seeking counsel, seeking medical help, how do you cope as a counselor, as a pastor, as a medical practitioner sa daming ng mga problemang sinishare sa inyo? How are you emotionally? How do you stand your ground? Maybe you can start, Doctora. Yeah.
Thank you for asking that, because not a lot of people ask how like boksu are, or how counselors are, how psychiatrists are. So parang, of course, we are also humans,
Yes,
no?
yes.
And definitely I get tired. I wanna say that. There are okay days, there are not so good days as well. Kaya important din what Jen said, the self-awareness, no? The awareness of your bandwidth, the awareness of your health. Sometimes, di ba, pag kunwari ho, mas absent ka,
Yeah.
or emotionally you're undergoing through something, maybe a family crisis as well, you can also like take the time to step back a bit. So for me, it's also a learning process. Dati I was just so dead tired inside, like parang seeing 22 patients, parang dump. Parang after parang parang ako na-rape internally, parang ganon. So, sabi ko parang, hindi to sustainable kasi bukas ganito, bukas ganito, parang I'm not living as well. So, parang na-realize ko na I also have to put corners and boundaries. So, yun, take care of my physical health, no? Sabi ni Ate, yung nutrition, diet, exercise. Nagtitry ako minsan mag-Muay Thai, mag-boxing. Also, sharing to one or two persons, no, na parang ako yung nakakapag-share naman ako, ganyan. And then sometimes I also need like, kasi introvert, no, I need my time of quiet. So a full day na parang interact. Sometimes I just want to sleep or sleep or play with my dog, ganyan. Ganon. And of course, isa rin sa tinatry ko gawin bago mag-start ng, for example, duties or responsibilities or patience, to like have a time with him,
Yeah.
no? Kasi parang doon ako kukuha na, Lord, ikaw na lang manguna, ikaw magsabi, ikaw ganyan. So yun, pero not everyday nagagawa yun lahat, but as I'm able.
Yeah.
Yun.
Thank you. Ate Christina.
Well, the Torah talks about self-care and boundaries, which is very, very important. Boundaries is also defined as where do I begin and end,
Right.
and where does my client starts, and ends. So that psychological boundary is very important. What does it mean? We empathize, but we have to know we should not lose our self-differentiation.
Tama.
Okay? So we empathize with our client, but we should remember that that's a struggle, a pain, not yours. You don't carry it with you.
Right.
So a lot of my students were saying, Mom, I do not know how to do that. If I hear people's, sharing their problems, I go home, I bring their problem with me. You cannot survive like that, because it's their struggles, their issues. It's not yours.
Yeah.
Okay. Number two, what helped me a lot in my practice, other than practicing self-care, is understanding that even though I do counseling and I teach counseling at ATS, my primary identity is still a pastor. I still see myself as being called to be a pastor. It just so happened that, I have training in counseling, right, in marriage and family counseling as well. But understanding that it's not my job to solve their problems.
Right.
It's not my job to make them happy, if you have a messianic complex, it becomes a very different ball game.
That's true.
You feel like you have to
Save
see
everyone.
change, effect change, But counseling is not like that. Counseling is committing oneself to understand the person, where he or she is coming, entering into their emotional world, however messy, chaotic it is, but just willing to enter into their world to understand what it means to experience all these adverse experiences in life. Understand the patterns of behavior, and you can see their blind spot, you point out to them and support them there. Give them the necessary skills they need, the perspective they need, to help them. And as a pastor, it's always very liberating to know that I'm not entering into the counseling room alone.
Yeah.
I always say, Lord, I'm gonna meet this person in an hour. You have to go inside with me. Okay? God, the fact that God brings this person to me, there's something that the Lord wants to achieve.
Yeah.
What is that? I do not know. But making myself available and allowing the Holy Spirit to work through me is very important. So we have to train. We train ourselves one ear to learn to listen. Another ear is to listen to the Holy
Yeah.
Spirit's gentle voice. Sometimes, you reach what you call a fork, a junction. No, you reach a junction. Should you take this direction or should you take this direction? And a lot of times, the Holy Spirit would just prod you to take a certain direction, and only to realize that that was the right direction. So when you see it as a partnership with the Holy Spirit, it makes the load much lighter.
Yeah.
Because the responsibility is lies heavily more on God than on ourselves.
Yeah.
I
Yes,
wanna
Doc,
add
sige.
also. What's helping me also daily is I remind myself na there's a God and I'm not it. And carry what's mine to carry lang. And kunwari at the end of a long day, I make parang naglalagay ng period or an end. Like, tapos na, I'll make pagpag, ganyan.
Yeah.
Or, do I carry the day's burden lang. Parang, if that's for the, see, bukas na yan,
Yeah.
bukas pa yan, ganyan.
Correct.
Yeah. So, yun.
Sometimes kasi you cannot help it la. Sometimes people expect that you have all the answers. Alam bokso,
Hindi eh.
they expect bokso to know all the answers
Yeah.
to their questions, right? But we're not God, right?
Mm.
And we're not Madame Auring too, right? So we just honestly say that I wish I have answered to your questions, but I really do not know.
Right.
So knowing where our limitation is, our limit ito is very liberating,
Yeah,
very
yeah.
helpful.
Bokso.
Yeah. Medical doctors, they just need one act of compliance from the patient. One act. Take this medicine.
Yeah.
Now, if it's longer, it says, take this medicine for 30 days. Mas mahirap na yan. Because he might forget. He might refuse. O ga holo eh. Pabobit siya. Counseling is very, very demanding because you're not looking for one act of compliance.
Tama.
Because they have to deal with it every day. It comes back. It comes back.
Yes.
So it's so difficult. And a medical doctor talks to a patient, 5 minutes tapos na. But counselors and psychiatrists, they talk to you for 50 minutes. So the long hour is very draining because you have to be focused. You
Yes.
cannot lose track of what's
Correct.
going on, right? But then the next one comes in, another 50. And all of them are long-term, not one act of compliance.
Yeah.
You're saying, you should not do that, you should do this, then ang dami. So it's very demanding on this particular line of profession where you deal with psychological, not physiological. Physiological medicine, tapos na.
Yeah.
Diba? Wrong medicine, try this one. Pero siya, counseling, psychiatric, talaga, demanding. At the present time, I don't deal with very young patients. And I don't deal with very old patients either. So it's above high school age. It's very demanding because I'm not a clinical person. So they come and expect that I can sit there for 3 hours. And normally I do. I stay with them.
Yeah.
And then after listening to the situation again and again, then you get a more complete picture.
Yeah.
I kind of realized that everything that his psychiatrist can do, he's already done. It's up to him to do it lang. But the psychiatrist solution is you go and do it alone. So what I did with this young patient is, okay, let's do this together every week.
Nice. Accountability.
Every week. But it's not just me. When he and I go there, there's another group. There's a bigger group.
Oh.
And I know this group will accept him because I know this group.
Okay.
Because other groups probably will reject him right away
Okay.
because it's been many years na he had a condition. So last Sunday, I was speaking at Menuka. Is that,
Menuka.
yeah. So he texted me, should I go? I said, yeah, you should go. And so he says, okay, I'll go.
Nice.
Normally, if I don't go,
You will
Bobby.
go.
Oh.
so I'm doing something the psychiatrist will never do
Right.
because he's a professional.
Extra mile.
I'm gonna walk with him. So I told the parents, my solution is different from your psychiatrist because your psychiatrist did all of this, right? Tama. And he's supposed to do this, right? Tama. And didn't work, right? Tama. Okay, let's try this one. So the father says, yes, I want to try that.
Ganda.
Dito kapikyan, walk with them. Because even though we are not the healer, we do want to see them healed.
Yes.
Who wants the patient to be forever a patient? Only those who are in it for the money. Tama? Lan siya, we want him to get well. So kung I'm willing to walk with you, let's go together. So we went together and then sometimes I don't go. Si Hua, he will go. Then we go again.
Scaffold.
I make it irregular so that he's not fixated on me there all the time. And now he's saying, I will go. So I'm so happy.
Yay.
So like you say, the Lord works, we're not alone. The Lord is working in his heart. But the psychiatrist played his part, Lola.
Yeah.
He did a lot of analysis, and this young man already has seen a lot of these aspects that he did not see before. But I think that it's kauhya lang. He is like, because he cannot give anything more than that. So, Lokisi, we need a practical solution to take him out of his psychological prison
Yeah.
and let him merge again into the regular world.
Correct.
Yeah.
Correct. So,
Oh, by the
apart
way,
from,
in
yes.
the early years now, how come churches don't want the word counselors?
Was there such a time?
Yes,
Please
there was a
enlighten
time
us.
when they don't like the word counselors. For them, the counselor is the guy who goes with you to the summer camp and leads your devotion for 5 days. That's the counselor.
Oh.
It's a group counselor, but not a medical or psychological counselor. Because in the 1960s and 70s, when you say going to a counselor, isu diu xiao ah. Means you're mad. You're insane. Xiao eh, zao leki che ani na. So that's the stigma.
Yeah.
And that's why for a long time, counseling doesn't take off in Philippine churches, including Chinese Filipino church.
Yeah.
If you go to a counselor, sira ka eh. So
Yeah, yeah.
parents don't want to send their kids to counselors kasi boy kanchua eh pai. Takay kong hide usyaw ah.
Yeah.
So din simpu din chuan ke doon. So bolang kya.
Yeah, real talk.
Natawa si
yes.
Ate Christina.
Yung
That's
bayan
so
niya.
true. That's so
And then
true.
eventually, the younger generation became educated in English. Tama? And some of them took up psychology. Tama? And then some of them eventually became parents. And then they're open to it.
Yeah.
So counseling became more respectable and acceptable.
Yeah.
But there are some circles which are fundamentalist Christians. So they believe that psychology belongs to the devil
Yeah.
and Bible belongs to God. And the two
Yeah,
are
they
different
compromise.
worlds.
Oh.
And so they don't call themselves counselors. They call themselves biblical counselors.
Biblical counselors, you always carry a Bible?
Because they want to emphasize that
Yes.
there's no psychology in it. It's all purely from the Bible. Whatever, I mean, their framework is purely biblical.
For them, secular psychology in the university is un-Christian or anti-Christian.
Oh.
So, lan si biblical counseling.
Oh.
So, lan si Bible-based ko. So, hikwan thinking si fundamentalist. And then, there is the naturalist. Naturalists, they only believe nature, no supernature. So for them, counseling is good, everything good. Bible bad because it's superstitious, kasi religion.
Oh.
So ito nga extreme ko. And then there's the middle balance. So si tama, dinekong ko. Lan si Christian psychiatrist, lan si Christian counselor or psychologist. So ganun yan na. Naturalists, they will say, sila gina ka na aniya. Kasi soyhan no, he abused na. So it's a aniya. Natural explanation.
Okay.
Na fundamentalist si Kongo, kanay na aniya. Kasi ukuy eh. You pray out the spirit. That's the spirit of lust. That's the spirit of simi whatever. Bible lang la. Di tiyo itaksyon kyang la. Di kay kangto iye Jose la. And then there's the middle, which says that, yes, there was a trigger event in childhood, which is a case of sexual abuse. Natural yon, tama? It's a cause, not a solution. So what's the solution? Well, solution is suyaw counseling, prayer,
Yes.
church community,
Yes.
support group, family acceptance.
Yes.
Solution. So secular psychology provides a lot of cause analysis, not COST, causation.
Causation.
Cause analysis. Kasi itiyang pai kiholang itipa. So tuahan ito pa palang. There's nothing spiritual or unspiritual about that.
Yeah.
It's just history, his personal history. Cause and effect lang yan. Di ba, ani ko? And then the solution na puro counseling ko, then maybe it's not so Christian. Pero na kung wow, counseling, wako Christian dimension na. So, para sa akin, okay yan. You're drawing from both worlds.
Yes,
It's just
yes.
like I'm a Christian, so in college, I only teach Christian mathematics. Kung paano yun? 1 + 1 equals?
God.
2 pa rin. So, if
One
you
plus
remove
one
the word
is one,
Christian, 1
God.
plus 1, 2 pa rin.
1 is equal to 1.
Because math is universal. Whether you're a Christian or not, math is math.
Yeah, yeah, yeah.
Walang Christian math.
Yes.
There are Christian mathematicians, but there's no Christian math. Christian way of solving bola.
Yeah.
It's a simple mathematical operation. So I think today we are fortunate that we are in an age where people are more cognizant of
Yeah.
this balanced approach
Yeah.
and benefiting from the natural world that God created, but not godless philosophy.
Yes.
And then drawing from the spiritual resources that God gave the Bible gave to us through the Bible and the church community.
Right.
Correct.
So I think it's more balanced that way.
Yeah. Balance and holistic, no? Yeah. Thank you, Boksu. So Jen, where are you right now? Yan. In closing, maybe what you can share to our viewers who are in the same path where you are right now. What can you tell them?
Like what I mentioned a while ago, no, during the time that I was in the ordeal, all I wanted was to bounce back to who I was before. But the Lord's plan through the pruning is for me to be a better person. So there were a lot of unhealthy practices from before that, by God's grace, I was able to veer away from.
Yeah.
I was able to, it may sound very cliche, but I was able to grow through the things that I went through. No?
Yeah.
Parang, diba, they say grow through what you go through.
Mm.
Yeah, so I would say, by God's grace, I was able to do that. And I think in terms of being more secure in God's love,
Yeah.
I know that God's love is unconditional. Identity is not based on what people
Think.
think. Yeah. So the people pleaser factor, I would not say, of course, that it's 100% gone. But I am working towards parang becoming less and less of being a people pleaser and more of being a God pleaser, I would say. Yeah. There are also a lot of things that I have learned throughout the journey. In terms of healing, I would say that I am still healing. I am still in the process of navigating some of the issues that I encountered or I struggled with. So there is still struggle, of course. And I think there will still be struggle until the day we meet God.
Right.
So there's no, parang here on earth, wala namang perfect. So we will only be perfect when we're already there with the Lord. But I have learned so many things that I would not have learned if I did not go to that rock bottom experience. And again, it may sound cliche, but I realized that in situations wherein Jesus is all you have, you realize that Jesus is enough. Kasi parang before I would cling on to the achievements, to the how people perceive me, to all the trophies. But when all of those were taken away from me, I realized that, okay, it doesn't, God's love is not based on what I can give Him or what I can do for other people. But God's love is because I am His child.
Yeah.
And that's it. Yeah. So maybe that's what I learned about myself.
Thank you for sharing that. How about from the medical perspective, Dr. Iris? What else can you say to our viewers? Is this something that no one can overcome, or this is something that anyone can overcome?
Okay. From a medical perspective, no, siguro I wanna address people who may be experiencing right now emotional distress or struggle. Particularly, is here kahit Christians, no?
Yeah.
Christians, non-Christians, but Christian na suffering, ganyan. First is, you're not less of a person if you are feeling very anxious, very depressed, having panic attacks. No, that doesn't make you less Christian, less of a person. And baka it would help if you would also put the last two words like right now. I'm feeling very down right now. So it's a right now thing. It's not a permanent,
Permanent thing, yeah.
Yes. And then another encouragement is to medyo mahirap pero to try to come out of hiding. So like tell at least one or, tell God, syempre, tell one safe person no about what you're actually feeling
Yeah.
or going through. Yun. And to echo yung sinabi rin ni Jen na yun parang as is where is, you are loved ba? Parang you are in this very rock bottom. You cannot perform as you were performing before. You cannot be in their ministry right now. It's okay.
It's
God
okay.
cares for you first as you are, as a person. Yun. Tapos siguro to address why carers ba or yung family.
Yeah.
No? Sometimes nasashock. Yeah, we can be shocked kasi grabe, drastic yung mga changes, ganyan. First siguro, we can yung what Atsi says, kanya, I notice, no? Like, notice or curious mang furious. Di, ang patlet song mga house chores lo, di ganyan. Parang, before you get furious, maybe you try to get curious.
Yes.
What's happening? Na-notice ko ganito, no? So, yun. And, medyo mahirap, pero yun, parang kung may time, no? Like, offer time, offer space, offer yung practical helps, like for example maybe cooking or go out kayo together,
Yeah.
sama sila somewhere. And what pastor shared kanina, no, the accountability and communities
Yeah.
helps so much.
Yeah.
Kasi realize na hindi sila alone, or hindi pa pwede mawala right now, we still have a meeting, kita pa kami ng friends ko, ganyan. So there's always something to live for pa kahit you don't feel it right now.
Yeah.
Yun. And sometimes paano ba, feelings are not always factual. No? It may feel very true, but it's not necessarily true about you. Especially yung mga negative and destructive feelings and thoughts.
Yes,
Yan.
yes.
And syempre yun, there's hope talaga beyond the condition, and that does not define you as a person.
Yeah. Thank you, Dr. Iris. Ate Christina.
We often hear about suffering. The topic of suffering often gets preached, but we seldom hear about the theology of healing. How does healing happen? Life is full of futilities. No matter how good you are, no matter how forward-thinking you are, there are things in life that you will realize outside of our control. What's our response? What's a biblical response to life's futilities? What's a biblical response to life's losses? Is lament. If we understand biblical lament, then we know that how healing would happen. Okay, in the 1960s, they did a study of juvenile delinquents, and what they found out is every single of those who committed some of the most heinous crimes, they don't have tears. At some point in their lives, they stop crying. Tears are given there for a reason. Okay. And so if we can find, again, God's design for tears, for tear ducts, and the pathway of healing through lament, we should be able to, prevent itong what we call mental breakdown. We will get hurt. We will be depressed, but we will be able to bounce back. So that's something that for us to think about. The Lord knows that life is hard, but He has also given us the pathway to healing. And if only we can spend more time reflecting on that, rather than reflecting on how people see us, what people are expecting of us, how we fare in comparison to our friends, then we will be more equipped
Yeah.
to face life and face it courageously.
Boksu, how do you think our relationship with Jesus can help conquer these increasing mental health problems? Yeah.
Whether you're a Christian or not, we're all regular people. Regular people get sick physically, sometimes emotionally. Regular people get healed physically, sometimes emotionally. The Lord Jesus Christ is the healer. Sometimes He heals through doctors and medicine.
Yeah.
Sometimes He heals through counselors and psychiatrists who belong to His family. Avail of all the resources He has placed before us. There are some very good Christian counselors and psychiatrists around. The Lord uses them to heal and to bless. Don't hesitate to avail the resources of the Lord because Jesus heals.
Thank you. Thank you, Boksu. Thank you to our guests, Dr. Iris, Jen, and Ate Christina. And thank you for joining us today in our discussion. We hope we were able to enlighten you in some of the issues you are currently facing. If you have any comments or suggestions, please drop us a note in the comment section below. We would also like to take this opportunity to invite you to come and worship with us every Sunday here at Jubilee Evangelical Church. We have English services at 8:30 a.m. and 10:30 a.m., Amoy service at 10:30 a.m., Taglish service at 2 p.m. You can also join us online through our FB and YouTube channels at 3 p.m. For more information, you can visit our website at jec.com.ph. Thank you and God bless us all.